Hi, in this video we'd like to straight dive into the topic so that to explain when does hyperemesis gravidarum symptoms start to show during your pregnancy, so you can actually prepare yourself and also get yourself to the nearest hospital to seek management. Ideally, of course, we recommend our patients to actually come to Antai and also receive the HG vaccine, which is currently the only effective cure for hyperemesis gravidarum. This treatment comes with a full refund guarantee because of how effective it is. And you will see full recovery within just a few days of using it. So HG symptoms and morning sickness symptoms are constantly confused to be the same, and mothers, especially those first timers, must be able to make a clear distinction. You don't want to stay in the state of HG where the body is completely weakened, in fatigue and constant stress. At the same time, you're supporting your fetus life. Another pregnancy is immense stress, and it is in no state that a mother should be in, especially for the entire pregnancy period, because it can lead to a potential miscarriage and also may threaten the mother's life. These are all completely avoidable situations, especially at Antai hospital, where treatment is readily available, where it actually solves the problem and not just manages the symptoms. So for HG and morning sickness, they usually arise at the same time because they do have similar mechanisms as to why they come and show up during pregnancy. It's because of H2 receptors binding with the new hormone introduced into the body, which is ACG. Now, this H2 receptors varies among different patients. Now, majority of women have very little H2 receptors. Only a handful of patients, HG patients, have an abundant amount of H2 receptors. That is why they experience hyperemesis gravidarum. So the first thing you want to notice is that, let's talk about the first distinct symptom, which is the vomiting. If your vomiting is consistently occurring throughout the day and it is very violently happening throughout the day, affecting your daily life activity, and it empties your stomach to the point where you start to vomit blood, bile, and also the contents of the inner lining of the stomach, this is already a clear sign that this is no longer morning sickness. Morning sickness vomiting is very mild and it doesn't persist for very long. If you notice that it persists and is very violent, it is a clear sign that hyperemesis gravidarum has begun to show up during your pregnancy around week 6 to week 7. Next symptom that we want to talk about is the nausea. The nausea and the constant headache. With morning sickness, it is only mild and fleeting, whereas in hyperemesis gravidarum, it is constant and also violent as well. So if you experience that headache that's happening non-stop, where you're unable to think or focus, it's causing mental anxiety, stress, being unable to do your daily activities, then this is another clear sign that hyperemesis gravidarum is actually affecting your pregnancy. Now you can make yourself to the nearest hospital to actually receive support. The next symptom that we want to talk about is insomnia. Are you able to actually get proper sleep? If you're unable to get proper sleep for over a week, constantly on edge and unable to have longer than 1 or 2 hours of shut eye, constantly being disturbed by the slightest environmental factors, for example, sound, light, even people talking sounds annoying to you can actually trigger mood swings. These are all another clear, distinct sign between morning sickness and HG. In morning sickness, you will experience nothing like that. The distinction is very, very, very far away. And the last one, which is another predominant symptom that many patients experience, which is the salivation. In morning sickness, you won't likely experience any form of salivation. However, in HG, hypersalivation is actually showing up now. Cannot control it. It's happening constantly to the point where you need to carry pails to actually fill it up because of how it's just non-stop secreting. This is because of the H2 receptor and ACG hormone binding together, leading to these types of reactions. So these are the 4 predominant symptoms that you can look out for during your pregnancy. However, there are several other secondary symptoms and also pre-existing conditions, complications as well, because of how extremely complex this condition is. Some may even experience predominant mental depression to the point where they are so depressed they are contemplating suicide and also abortions because of how suffering, how much suffering they're actually going through. These are all other symptoms that you can look out for. Furthermore, you're unable to put down any food, medication or water anymore, leading to severe loss of body weight. That's another clear indication. During these types of states, you should no longer wait or stay at home anymore. Please seek nearest clinical assistance and support. Otherwise, you are putting yourself in danger, not only for yourself, but your baby as well. And many times we can actually prevent it. However, at Antai Hospital, we actually can effectively treat it within just a few days of hospitalization, and you can be sent on your way home. This treatment is only available at Antai Hospital and not anywhere else. And this treatment is our HG vaccine, coming in the form of injections and oral medication, and the results speak for itself. So HG patients, please get in touch with us as soon as you can, preferably before pregnancy, so you can have a peace of mind during your subsequent gestation or even during the midst of pregnancy. It does not matter, because our HG vaccine comes with a full refund guarantee to ensure that your Hyperemesis gravidarum is eliminated. So I hope we've explained the distinction and some symptoms to look out for, and also if you'd like to seek our HG vaccine and also witness how effective it is, please visit our website, set up a consultation with our doctors, and let's get this treatment to you as soon as possible. Please stay tuned to our next video and also leave me some feedback down below.